Hi there. Welcome to the Sector Readiness and Workforce Capacity Initiative online module for workforce planning and development. My name is Stacy Field. I'm a Workforce Engagement Coordinator with the Health and Community Services Workforce Council, and I'll be taking you through this module. The modules were actually broken up into 3 sessions, and this first session will focus on providing a brief overview of the health and community services workforce, the importance of workforce planning, looking at what is workforce planning and development, and how you get started on a workforce planning project. So first of all, I want to look at a bunch of information that informs and provides evidence for workforce planning. And a lot of that is drawn from the Health and Community Services Industry Skills and Workforce Development Report that was released in August 2013, produced by the Workforce Council, and it provides a state-wide overview of health and community services. So I'll be pulling out some pertinent bits from this report, but if you'd like to look at the full report, it's available on our website. So the first figures that I want to look at, and these are very important ones, is that healthcare and social assistance is the biggest employing industry in Queensland. So we have 290,000 employees working in our industry. So that's about 12.4% of the entire total of employed people. And that figure is from February 2013. So what this shows us is, despite some challenges in the labour market, including government cutbacks, we're actually still standing strong. So that's why the slide is titled Standing Strong. So we're quite resilient as an industry as well. So looking at the top 5 industries and what's happened in terms of their employment over the last few years. And particularly throughout the global financial crisis, what you can see is healthcare and social assistance is actually a pretty stable employer. When there were declines in construction, retail, and manufacturing caused by the global financial crisis, we were actually increasing our employment. So we're a pretty safe employer, pretty attractive to people who are looking for some stability. We are also a growing industry in terms of employment. So we're projected by 2017 to have, 52,400 new jobs, approximately. So that's a huge increase. That's an increase of 1 in every 4 jobs going to health and community services. And we're a pretty consistent provider of new jobs across all industries. So some of the factors that contribute to this growth is the projected growth, the National Disability Insurance Scheme, the ageing population, the increasing demand for care services. So that's around childcare, disability care and aged care, and home-based care services. Not only across the state are we looking to increase our jobs, but we're a provider of employment at a regional level as well, quite significant amounts of employment. And in most regions, we're among the top 4 employing industries. So in some we're higher than others. Wide Bay, Toowoomba, and North Brisbane are significantly higher than others. Mackay is a bit low in terms of their provision of employment in comparison to other industries. But what we're looking at is into the future growth across all regions in terms of our regional employment. So what you can see in the slide is that across all regions, there'll be an increase in growth. In some regions, there'll be more growth than in others. Our top employing occupations you can see there, and these are the ones that people will most often associate with our industry. So nurses are obviously the top employing occupation. And the rest of them include, a lot of care professionals, GPs, and, these positions cut across both health and community services. But a lot of it is around primary care and community-based support as well. One of the significant issues that's driving these the employment situation in our sector is the ageing population. And projected ageing over the next 20 years or so. So what we can see is that people will be ageing. There will be, I think by 2030, there will be, a quarter of people aged over a quarter of our population will be aged over 65, which is, a very significant shift in our population. And in terms of provision of care services and the need for caring roles, this is one of the most significant pictures that we can show. The other very significant picture is what ageing means in terms of the workforce, and particularly our workforce in health and community services. What this basically shows, first of all, is that the ageing of the workforce is a very, very significant issue across all industries. And particularly ours, the labour market is simply shrinking because there's more people who are retiring or entering retirement age. And in particular in health and community services, 47% of our workforce is over 45, which will have a significant impact over the next 20 years in terms of supplying workers to care. The median age in our workforce is actually 43. And in other industries, it's 39. So in comparison to other industries, we're an older workforce. So that's another significant factor in workforce planning. So a response is needed, and a response is needed quite soon to some of these factors and more. And we'll talk a little bit about that in the next session. So health and community services need to get pretty smart and need to get pretty strategic if we're to compete and obtain the workforce that we need into the future. So one of the ways that we need to do this is through workforce planning, and doing that at an organisational level as well as a regional and industry level. So what is workforce planning? In order to be able to understand and bring other people on board with what workforce planning is, it's important to be able to describe what it is and, I guess, sell this concept and ensure that people understand why it's important. So one of the ways that we do that is we talk about what the aim of workforce planning is, and that's to get the right number of people with the right skills and capabilities, organised in the right ways and interacting in the right ways, for the sake of better wellbeing and care for the community. So what you can also do is insert your own organisation's vision or mission into that last line. So, within your organisation, you can be looking at, what is the kind of workforce we need? Who are they? What skills and capabilities will they have? How will they be organised, and how will they be interacting to achieve the mission and vision of our organisation into the future? So that's the basic aim. It's fundamentally about ensuring that we have what we need to do what we need to do. So looking at some of the terminology that surrounds workforce planning and workforce development, what we often find is that some definitions help. So the first one is workforce planning. So workforce planning is about the process. So it's looking at what you need for the future, what you've got now, looking at the gap in between them, and how you actually respond to that gap, how you actually close that gap. So it's very much about exploring what the future is going to be like and forecasting what you'll need, designing to that, and doing a lot of analysis to build an evidence base for your plan. So it's a strategic and future-focused process. And as opposed to workforce development, which is also strategic, but it's about the strategies and actions that you undertake to achieve the workforce your organisation or industry needs for the future. So this is very much about the acting, the responding, the actually doing the plan that you've done, but it's also about reviewing it. So there's a fundamental link between workforce planning and workforce development, and that is around very much an action learning cycle. So workforce planning leads to workforce action or workforce development, which should lead to reflection on the outcomes of that, learnings from that, and ongoing planning and action. Workforce planning will inform workforce development, but in turn, workforce development will also inform further workforce planning. So I guess that's the important link. So I want to move now to the Workforce Council's approach to workforce planning and our workforce planning framework, which is reflected in this Plan, Act, Reflect, Learn cycle. So I'll show this to you now and just talk very briefly about this. So this is the Workforce Council's workforce planning framework, developed over a number of years of working with health and community services. So it's based, as it says, it's a holistic and future-focused approach. So rather than looking at what we currently have and then what we'll need into the future, we look at what we'll need into the future and understand and analyse what we've got as a starting point. We treat workforce planning as a project. And so before we leave this session, I want to talk to you about the first step, which is actually defining the project, the workforce planning project. So the scope and engage phase of the workforce planning framework is actually about ensuring that everybody's on the same page with what the workforce planning project will aim to achieve, the scope of it, what will be in and what will be out, and those sorts of important things. So the first step in this stage is to scope the parameters. So this is about ensuring that you've got buy-in from key people in the organisation who will give you a mandate or not to undertake a workforce planning process. And they will also help you agree on the scope of the workforce planning project and clarify what the parameters of it are, what's in, what's out. And that will form a project plan which clarifies the goals and outcomes, help you develop a project plan which identifies key milestones and products, that will allocate resources and responsibilities, so defining, who will actually be involved in this project and how will they be involved. And it will look at, what will be the performance measures, how will you be able to tell that the project is progressing, that you're actually producing what everybody's expecting. And then also getting endorsement of the project plan, as you would in relation to any other project in your organisation. A really important part of workforce planning is about stakeholder engagement as well. Workforce planning inevitably involves change, or at the very least a perception of significant change, and that can scare a lot of people. But beyond that as well, there's a lot of people within your organisation and outside of your organisation that will have some significant information to provide to you and resources to provide to you in terms of developing your workforce plan, but also implementing it. So we're, as a part of the scoping and engage phase, which is, starting off this project, we also, we promote the identification of the range of stakeholders and identify how you're going to engage with them throughout the project and include that into the project plan. So just to finish off, planning the workforce planning project is about identifying what the aim, purpose, and goal of the workforce planning project is, getting agreement from that and obtaining buy-in from decision makers, identifying who the project's team and leads are, and scoping the parameters, identifying what's in, what's to be included in the workforce plan and what's not to be included in the workforce plan. So that could be, for example, including volunteers or not including volunteers, or focusing on one particular part of your workforce. It might be a unit or team within your organisation, or it might be including the whole workforce, top to bottom. And then also looking at the internal environment, looking at the state of available data within your organisation, looking at, what stage in the business cycle or the strategic planning cycle your organisation is, and identifying, what the key strategic goals are of the organisation, and being clear about that, and being clear about how the workforce plan will fit into those organisational goals. So these are some things to think about and focus on before progressing onto the next stages of the workforce planning process. And this is the end of the first session. So before logging into the next session, these are perhaps some things to collect information about. So thanks for joining me. And we'll see you in the next session.